All right, there it says pharmacology, so welcome to pharmacology. But my intention in this class is that this is not one of your most important courses. There will be some questions pertaining to pharmacology and medications on the national board. In general, everybody gets them right. I could probably tell you in the next 15 minutes what those questions are and what information you need to know, which means that all the rest of the course is superfluous and irrelevant. So recognizing that this is not one of the most important courses, nevertheless, most students over the years that I've been teaching this, which is a lot of years, I've been teaching the pharmacology class ever since the dental hygiene program first came to West LA College. So I don't know if you know the history, it actually was at LA City College. And then they moved in the, I guess it was the early 80s. And so I've been affiliated since then. And how I got involved in it is they had, when they were over at LA City College, they had a kind of a pharmacist teaching the class. And when they moved over to West LA College, I guess he didn't want to bother traveling it was a distance, and I think he was an old guy, and I think he'd stopped teaching at that time. So I was at that time a young guy. I'm now probably as old as the old guy who stopped teaching. But at that time I was a young guy, and I had been hired here to teach physiology and anatomy, and some of you unfortunately had to suffer through my classes. But my research background was all in pharmacology. And I was in grad school at University of California Medical Center in San Francisco. So I can't say I was the world's greatest researcher, because if I was, I'd be doing research. But the research that I did was actually pertaining to the effects of different medications on electrical activity of different cells in the body. So I had a pretty strong background. I actually had 2 years of pharmaceutical chemistry that I took with the pharmacy students. I wasn't the pharmacy major or anything like that, but I took that, and I've had a lot of pharmacology courses. So they needed somebody in an emergency. They said, they asked me, could I do it? I said, yeah, I could do it. I had actually taught pharmacology to both nursing students and respiratory therapy students previously. So anyhow, I've been affiliated with the program ever since, and it's been a great joy. It's really one of the best things that happened to me in terms of working here, is just being able to teach you, because you are really a wonderful group of students. You know how difficult it is to get into the program, and the students just get better and better. So anyhow, the intent here is just to actually kind of make this not a low-pressure course, unlike some of your other classes. You've made it through the first year. You did the hard part. The hardest part was the first semester, right? Second semester was maybe a little bit easier, not much. And I think that everybody will tell you that I think the second year won't be as demanding. And one of the reasons why it won't be as demanding is right now we're doing the pharmacology in the summer, so that's one less class that you would normally have in the fall. But things kind of start to become repetitive. And you'll start to hear a lot of the same stuff that you'd heard that was all new in the first year, and you start to hear it over and over again. Now, our goal in terms of pharmacology, in terms of drugs, is twofold. We want to learn not only the medications that are used in the dental office, and that would include everything from antibiotics and pain relievers, the analgesics, anti-inflammatory drugs, and so on, that are relevant there. But also, as you will see with the National Board, they give you case studies. And so they want you to be aware of the medications a patient is taking. And as you will see, if you haven't already with your patients, there's a lot of people taking all kinds of stuff, especially antihypertensive medication and medication for diabetes, and some antidepressant drugs, and so on. And so they expect you to know a little bit about the medications they're on. And some of the drugs, I won't say a majority of them, but a certain percent, can have effects on the on oral hygiene and the mouth and so on, and increased risk or frequency of dental caries. I will tell you, I'll give you an answer to one question on the National Board right now. All right, this is one of the most important answers to the questions. The most frequent side effect, adverse effect, that you will see medications have, anybody want to guess? Yeah, xerostomia. So you already know it. So to the extent that salivation is important in terms of oral health and affecting the frequency of dental caries, there is a really high proportion of drugs that cause xerostomia. In fact, almost every antihypertensive drug, almost every drug that's psychoactive that affects the brain, usually causes xerostomia. So there are some other medications we'll get to that have other effects. Some of them I'm betting you already know. Does anybody know which medications can cause gingival hyperplasia, enlargement of the gums? All right, very good. I've heard the answers. There are two major drugs, are Dilantin, which is used for what? Seizure. It's an anti-seizure, although it can also be used for heart arrhythmias. And the other are certain calcium ion channel blockers. Anybody know what they're used for? Hypertension. So we do start to see some other drugs that have some other strange effects. There's also a small number of drugs that cause something, and I don't have to write it down here because, let's see if there are a small number of drugs that cause, and the word is dysgeusia. Has anybody, I think I spelled that right, has anybody ever heard of dysgeusia?
Taste.
A funny taste in the mouth. Sometimes a metallic taste, such as flagyl and so on. So there are some drugs that do have effects that are noteworthy and that they expect you to know on the national board. Well, I practically have already told you half the information you need to know. All right? So if on the national board, if they have a case study and they've got some medication and you have no idea what it does, and they ask you, what should you be concerned about, your answer is xerostomia. So that's just told you half the answers. So let's see. All right. So anyhow, coming back to let's see where I am here. Sometimes I get. So that's really the two reasons that we want to cover drugs, is not only to understand the medications used in the dental office, but some of the medications that your patients are on. So this is on the website. I don't know if anybody downloaded it. You can just download the syllabus for what it's worth. Obviously, I have listed here that we're meeting on Fridays. Actually, what does it say? Oh, it's actually scheduled for Saturday, which is interesting because I don't teach on Saturday at all. I don't work on Saturday. So, but they scheduled it for Saturday. So I guess this, as bad as it is coming in the summer, it's still better than coming in on Saturday morning. So they had a schedule for 9:35 to 12:50. Anyhow, if you need to reach me, the best way to reach me is by email. I check my email several times a day. If you leave me a phone message, I check my phone messages once a month. So I just don't like dealing with the phone. So we've written on the syllabus, this course presents the basic principles of pharmacology, including pharmacodynamics and pharmacokinetics. And make this bigger here. And we will be learning exactly what that means, pharmacodynamics and pharmacokinetics, adverse reactions and contraindications of selected drug groups. Emphasis will be placed on those drug groups especially relevant to dental practice, including analgesics, anesthetics, nitrous oxide. We'll see if we have time. I know you've already had pain control classes and covered nitrous oxide. If we have time, I'll review some of this. Some of you may have forgotten the planes of anesthesia, the stages and planes, right? Does anybody know what stage and plane you're supposed to use normally for nitrous oxide? Okay, so it's actually stage 1, plane 2. Stage 1, plane 2. So if we have time to review that, it sounds like there's no need to review it. So, all right, and anyhow, anti-infectives, antibiotics, antiviral drugs. In addition, the most common classes of drugs the dental patient is taking in the management of common diseases and disorders will be covered, including autonomic drugs, cardiovascular drugs, antihistamines, anti-inflammatory, sedatives, anxiolytics, antidepressants, hormones, and anti-neoplastic drugs. And we'll just see as time permits how many of this we can cover. I think all of you have the lexicon book. So look, there's a lot of drugs here. This is a lot, you know, we're not going to do this entire thing. All right, so we could, I mean, you know, obviously if you pharmacy students spend 4 years learning drugs, so we can't cover in a few weeks what pharmacy students cover in 4 years. All right, so we don't care about SLOs, student learning commitments. I don't care about them. They make us write them and nobody cares. Somehow they think that by writing all that stuff, that affects teaching at all. I don't know. Anyhow, the lecture outline is the main thing you needed, so you've all got that. And we will have, let's see, 2 exams, 2 semester exams and 1 final. So 3 exams altogether. And I think that the 2 semester exams will be 100 questions each, so you just need 1 Scantron. I used to make them longer. I think I'll try to top it at 100. I used to give more. The final, though, will be more than 100. And so you'll need 2 Scantrons for that. So altogether you need about 4 Scantrons for the course. So I think that, I don't know, is pause open?
Yeah.
Is it? Okay, so you can get the Scantrons there if you needed any. And I've listed, there is a book that if you really desperately want to spend money, you can get this, Applied Pharmacology for the Dental Hygienist. As I said, it's a paperback. It's several hundred pages, not even that many 100 pages, and they sell them for like $150. So we don't want you to spend that. You already have the lexicon book. That's really the best resource that you can use, and there's no need to get the PDR or physician's desk reference. You're going to be, there may be uses for my website, including that I hope to have these lectures up. I'll try to post them within a few days after I tape them. And obviously the dates of these exams, assumed we were meeting in the fall. I don't know what our dates of the exams will be. I don't know how much we're going to cover on any given day or week, because we're not meeting the way we normally do. So we'll just kind of play it by ear, and I'll give you plenty of advance notice. So the 2 semester exams, they're each worth 30% of the course grade. The finals worth 40%. So that's basically it. Sometimes students who've had me for other classes say, well, do you drop one? No, we don't drop any in this class. Everybody does fine, okay? You're all hard workers. You wouldn't have made it this far if you weren't. Everybody is going to get, most of you will get A's, maybe a few will get B's, nobody should get less than that. So that's usually what happens. So, and everybody can get an A. So those are the cutoff lines as far as the grading. As far as attendance, I'll have a sign-in sheet to sign to check your name off when we do meet, but we don't make a big deal as far as attendance. Since this is being videotaped, I probably should say that. I'll have to edit it out. All right, so anyhow, we won't worry about cheating. Nobody's going to do that. And the dates obviously are not correct, but this is really the order of topics that we're going to cover, which is exactly the order that's in the lecture outline. So today, in addition to introducing the class, we're going to start to present principles of pharmacology and drug legislation, and we'll see if we get to prescription writing, and then we'll get into pharmacokinetics and pharmacodynamics, whatever those mean. And after we get through the principles, and these principles are very important because these are the vocabulary that we use to describe drugs, all the drug groups after that. And then we'll start to talk about the different drug groups: autonomic drugs, cardiovascular, respiratory, GI, anti-diabetic, sedative, anxiety, narcotic, analgesics, antibiotics, anti-neoplastic, and so on. So the main thing that I'm going to emphasize in this class is understanding the class of drugs, the class of medication, not the names. The names, the names are the most confusing part. There's so many names. They're hard to say. They're hard to write. But I will try to explain all this naming for you. All right, so that's the syllabus. So that finishes that off. And just a few words on the website. So this is a kind of a work in progress, and it needs a lot more progress, but I've made quite a bit. I started the website, I guess, about 4 years ago, and it's really in the last year where I've really expanded it. It's still a hodgepodge. I'm the webmaster, so I'm not very knowledgeable about doing websites, so it looks kind of sloppy. But I've got a lot of resources on it. So I have it for biology and for anatomy and for physiology and for this class, pharmacology. And what I started to do this last year is to post my lectures as videos. I've now posted 135 hour-long videos on YouTube, and so they're linked. That's for anatomy and bio and physiology. I'm still in the process of doing that. And I actually checked YouTube. They have what's called analytics, and they will tell you, how many hits you've got altogether. I've had over 1 million hits on my videos, and some of my videos. The first video I ever posted was cellular respiration, and I have 117,000 hits worldwide in a couple of years. So actually the one that I posted most recently that's just skyrocketed is embryology from anatomy. And I guess because, in fact, if you do a search on YouTube for embryology, I'm the #1 first thing that comes up. So I'm not the #1 for cellular respiration. Salman Khan beats me. But he hasn't done a video on embryology. And he's a great guy, but he hasn't done one on embryology, so I actually come up #1 on embryology. But we'll get pharmacology up, I hope, this summer, and there's really not a lot. There is some stuff on pharmacology on YouTube. You can find everything on YouTube, but not too much. So anyhow, I generally don't use PowerPoint slides. If anybody wants, if you miss from my lectures, if you'd say, boy, I'd sure like to have PowerPoint. So these are links to PowerPoint slides, so if you want to have fun looking at them, here they are. And so you can go through that and watch a blue screen and just see all this blue stuff, and then just pretend I'm reading them to you. All right? Isn't that what usually happens with PowerPoint? There's the person, Controlled Substances Act of 1970 and Omnibus Budget Reconciliation. Next. All right, I really don't like just presenting that way. But anyhow, those are PowerPoint slides. I've posted a whole bunch of other PowerPoint resources for anybody who cares. Here's a link that when you ever have blood work done on yourself or anybody you know, and you want to interpret those blood tests, these are both very useful links to understand what those blood tests are all about. If you want to have pictures of all the pills, let's see if this is working. Let's see if we're going to get pictures. Yeah, here it is. So you've got lots and lots of pages. You can go and look at all these pictures of pills. All right, this is great. All right. And this is actually what's in a PDR, a physician's desk reference. So I've already linked it on my website. So I knew somebody who was interested in medicines, and they basically took color images of pills, and they decorated their room, their bedroom, with pictures of pills. But all right. So that's the pill pictures, and these are some of my favorite resources. Obviously, all of you know how to look up stuff using Google, but among my favorite resources for information on drugs, www.drugs.com has wonderful information. On herbal products, here's one. for information on nutritional facts that appear on the labels of packages of food that you buy. This is from the FDA, the Food and Drug Administration. Something that I'm going to be telling you about, FDA drug safety communications. This is not something you really need to worry about, but there is constant, every other day there's new updates from the FDA about medications. And it's a real challenge to keep up with this stuff. And I'm going to give you some of that, some of these in just a moment. Another resource that I like is review articles on diseases and treatments from the American Academy of Family Physicians. These are very readable, and they really explain whatever condition, whether it's diabetes, whether it's epilepsy, whether it's transient ischemic attacks, TIAs, whatever it might be. You can look it up, and they give you pretty readable articles. Another wonderful resource is the Mayo Clinic. The Mayo Clinic is considered one of the top 5 medical institutions in the world, probably. You can basically find under education, actually health information. So you can look up diseases and conditions, symptoms, drugs, tests, procedures. It's all very readable, and it's just one of the best resources. I only mention this because if you do a Google search and you just see all this stuff come up, you don't know for certain which ones are reputable and authoritative sources and which ones aren't. And the Mayo Clinic is absolutely authoritative. So if you need to look up anything. Another one, the Center for Disease Control, the National Library of Medicine, the Human Genome Resource. Let's see, there's another one. Let's see, I skipped. I've got it here. Another one, I don't know if I listed it there, if I'll add it, but Johns Hopkins also has resources on it. Again, also one of the top 5 medical institutions in the world. So, but the Mayo Clinic is a wonderful resource. And of course, resources for teeth as well. I think that's, and here if you want to practice questions, I've got all kinds of links to practice review questions. Let's see, what's this? All right, so here's I'm not saying you need to do this, I'm just saying I've made it available. So here's practice questions with the answers on all kinds of different topics. So you could go through that if you want. You don't have anything better to do. All right, so much for the website.